Hello, my name is Dr. Dewan S. Raja. Today I will discuss about Red Man syndrome. Red Man syndrome is a non-IgE mediated hypersensitivity reaction characterized by flushing, rash, and sometimes hypotension during or shortly after a rapid vancomycin infusion. Even we may have Redman syndrome due to oral intake of vancomycin. Vancomycin is an antibiotic which breaks down the cell membrane of the bacteria. So Redman syndrome is an adverse effect of vancomycin. Pathophysiology, not a true allergic reaction, that is, it is not IgE mediated, caused by direct degranulation of the mast cells and basophils that increases the release of histamine. Mast cells and basophils are connective tissue cells, so they will be degranulated, and the content of those cells, mast cells and basophil, mostly histamine and some other components. So there will be release of histamine, and that will lead to Redman syndrome. Rapid infusion of vancomycin is the main key risk factor. Clinical feature flushing and or erythematous rash, especially on the face, neck, and upper torso. Torso means abdomen and thorax. Pruritus or itching, sometimes hypotension, angioedema, rarely. Chest pain or dyspnea typically occurs during or within minutes of vancomycin infusion. But as I mentioned previously, oral intake of vancomycin may lead to Redman syndrome in some individuals. Risk factor rapid vancomycin infusion greater than 10 mg per minute, high doses, fast exposure to vancomycin. Okay, these are the features from I took it from Google's. This is Medici. Okay, this is the Redman syndrome caused by infusion of vancomycin. Here, also Redman syndrome due to oral intake of vancomycin. So we are seeing red erythematous condition. There may be itching and hypotension. Okay, we got that. Now let's go to the management. Stop or slow the infusion of vancomycin. Administer antihistamine, that is diphenhydramine. Re-challenge cautiously after symptom resolve. Infuse vancomycin more slowly, greater than 60 minutes or 1 gram per hour. Consider pre-treatment with antihistamine or future doses if vancomycin is essential. Prevention: infuse vancomycin slowly, maximum rate of 10 mg per minute. Pre-medicate with antihistamine in patient with prior history of Redman syndrome. Okay, let's get to the summary. Cause vancomycin rapid infusion, but again, oral intake of vancomycin may also lead to Redman syndrome in some individual. Mechanism: histamine release from the mast cell, from the basophil. They have some inflammatory substances, granules, those are breakdown. So there will be release of histamine. Others like heparins, serotonin also released from the mast cell, and basophil will give emphasis on histamine release in case of Redman syndrome. Symptom: flushing, rash, pruritus, hypotension, timing during or soon after infusion. Treatment: stop slower infusion, use antihistamines. Prevention: slow infusion, antihistamine pre-medication. And that's all about the Redman syndrome. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.